Had my mom been in there, my sister and I would have known what was going on, and all of the trauma that we went through would have been significantly reduced.
It's been over 3 months since 70-year-old Alfred Jobsey spent most of his final hours alone in the emergency room at Health Sciences Center. Since then, the family has been seeking answers.
This would have been a traumatic experience without COVID, but you factor COVID into it and made it one that it is like that is now a defining moment in our lives.
According to Shared Health, an essential care partner is a family member or a friend of the patient providing support involved in decision-making, care coordination, and continuity of care. But Teresa Jobsey, wife of Alfred, says she met all the criteria as an essential giver, yet the hospital denied her access.
They asked questions that I had all the information to answer. He was on drugs that, I'm sorry, you shouldn't be making decisions. And I had all the answers and they didn't ask me.
The family says Shared Health apologized for not granting access earlier. Alfred, who was living with esophageal cancer, was left alone for 12 of his last 18 hours. In a statement, a spokesperson from Shared Health understands the strain visitor restrictions have had on families. Quote, visitation principles have been regularly reviewed throughout the past 20-plus months by infection prevention and control experts in an effort to find a balance between the known risks of the virus and the valuable connections patients crave from loved ones. Thwaite says the family sent a letter to Health Minister Audrey Gordon about everything that happened, but received a response from a deputy minister instead. They are calling on the government to fix staffing shortages, which has become a major issue over the past several months.
It's, again, one of the many tragedies of COVID-19.
A team of researchers at the University of Manitoba are studying the impacts COVID-19 has had on end-of-life care. Psychiatrist Dr. Harvey Max Chochinov from the University of Manitoba says incidents like these can have long-lasting effects.
Family members can't be there to attend to final business, say final goodbyes. Again, know that they followed a path of least regret, that they can know when they're there that the patient received the best care possible. And so they're left with all of these lingering questions.
Alfred Jobsey died on September 3rd while being transported in an ambulance from HSC to palliative care. The family is advocating for change, so no one else has to go through the same situation.
We want people on the outside to know their rights, but yes, in certain circumstances, you are allowed to fight. And we also want the higher-ups to let the staff on the ground know that they are allowed to make that exception.
Alicia, Teresa, and Cindy will be donating blood on Friday in Alfred's memory. In Winnipeg, Alex, Karpa City News.